Before we begin, all thoughts of suicide or self-harm should be taken seriously. If you or someone you know has reported thoughts of self-harm, please call 911 or contact your local emergency number immediately. Now, while there are many subtypes of OCD, only a few are recognized by most people, like contamination or order and symmetry, for example. But one theme of OCD that is not understood well is suicidal OCD. In this video, we'll dive deeper into what suicidal OCD is and how therapists treat it. Let's get started. So, what exactly is suicidal OCD? Despite what the name might suggest, it doesn't mean someone wants to die. Instead, it involves unwanted thoughts about suicide that cause a lot of anxiety and distress. These thoughts are part of the obsessive thinking pattern that comes with OCD. When it comes to signs of suicidal OCD, it often shows up in a few ways. First, there are the intrusive thoughts themselves. These thoughts are not voluntary, and the person experiencing them finds them deeply disturbing. Second, there's a need for constant reassurance. People with suicidal OCD might frequently ask their loved ones or professionals for confirmation that they're not suicidal. The final sign is avoidance behavior. To cope with these thoughts, they might start avoiding anything that triggers them, whether that's certain places, objects, or even conversations. If any of these signs sound familiar, don't worry, it's important to know that there are effective treatments available. One of the most common approaches is cognitive behavioral therapy, specifically a type called exposure and response prevention, ERP. This method helps you face your intrusive thoughts without giving into the compulsions or avoidance behaviors. Medication, such as SSRIs, might also be prescribed to help manage symptoms by balancing the brain's chemistry. And finally, mindfulness techniques can be really helpful, teaching you to observe your thoughts without judgment and to recognize that these thoughts don't define who they are. If you relate to anything we've discussed, it's worth considering reaching out for help. Suicidal OCD is something that can be managed with the right support, and you don't have to go through it alone. If you're interested, consider booking a trial therapy session with us. We're here to help you. The link is in the description.